Long way.
Thank you. MEC for Health in KwaZulu-Natal, Ms. Nomagugu Simelane, government officials who are present today led by Mr. Mabaso, members of the media, ladies and gentlemen, we wish to once again welcome and thank the members of the media for gracing us with your presence at this media briefing. As we continue to navigate our way around this pandemic, it is thanks to our partnership with yourself that our people are able to stay safe and suitably informed about the latest development concerning COVID-19 and what they need to do to protect themselves. Siyabonga ngokuba khona kuyini. Siyacela niqhubeke nokubambisana nathi ningapheli amandla. Lempi esibhekene nayo ngeke sayinqoba ngaphandle kwenu nangaphandle kokubambisana. As we start, we wish to convey warm wishes to all fathers on the Father's Day. Our country is blessed with many good men who are taking care of their families and loved ones. We pay tribute to the men who act as guardians and mentors to families. As we honor these good men of our country, we ask them to pay attention to raising children who will grow up honoring the dignity and humanity of girls and women of our land. Our country desperately needs its good men and exemplary fathers to build a South Africa which is at peace with itself and the world. Once again, happy Father's Day. With regard to the issue that is on news in the public domain about the diamond rush at KwaZulu-Natal, we have spent the past few days closely observing the developments in the KwaZulu-Natal area of Ladysmith, which have resulted in people flocking there in large numbers and digging in the hope that they will find diamonds. We have been concerned by this large gathering, which has carried the potential of being a COVID-19 super spreader event. We are always appealing to the people of KwaZulu-Natal to respect all COVID-19 regulations in all that they do in order to eliminate the spread of the virus. People should be honest and be responsible enough on their own by doing the right thing, even when no one is watching. Here, we're not only referring to the people who went to KwaZulu-Natal, but to the society in general. We cannot and should not conduct ourselves in a manner that compromises us or our loved ones in any way. In the same breath, we welcome the developments of a delegation made up of geoscientists, government officials, and other interested parties to KwaZulu-Natal earlier this week. We are aware that today, a delegation from the Department of Mineral Resources and Energy and the Department of Economic Development, Tourism, and Environmental Affairs, led by MEC Pillay, as well as MEC for Transport, Community Safety and Liaison, MEC Peggy Nkonyeni, are engaging with stakeholders and will together with relevant bodies pronounce on the outcome today at 16 p.m. This will bring certainty for the people on whether this or what have been found is indeed precious stone or something else. So as government, we have not pronounced ourselves on the matter, but instead we left it to geoscientists who have conducted their studies, and they will give the feedback this afternoon. Let me take this opportunity then to focus on the issue of the day, which is COVID-19. Compatriots, this briefing is taking place 5 days after His Excellency President Ramaphosa placed the country on alert level 3. This was in response to the rising infection rate in various parts of the country, which is extremely concerning for us. Although our own figures as the province are still fluctuating and do not show that we have peaked yet, there are, however, wrong signs of what appears to be sustained increase in the infection rate. About a month ago, KwaZulu-Natal was registering an average of 130 to 150 new infections. Sometimes our infection rate would go as low as 70 to 80 or so. But over the past 2 weeks, we have been recording more than 500 new cases each day, with only few exceptions where the numbers will be around 400. Worryingly, the province did cross the resurgence line on the 9th of June 2021, but then dropped below the alert threshold on the 10th of June. On the 15th of June, we again crossed the alert line, but currently we have remained below the threshold since the 16th of June. In terms of our emergency early warning system, a 10% increase in cases over a 7 days moving average will trigger an alert, while a 20% increase in the cases over a 7-day moving average will trigger resurgence, which may indicate that we are entering a third wave of COVID-19 infection. Be that as it may, there are many signs that COVID-19 is still around and deadly as ever. In fact, when you look at other provinces, you begin to realize that KwaZulu-Natal has been extremely fortunate that our numbers are still where they are and are not at a high level like it's happening in other 4 provinces. But we want to make one clear thing. The fact that our numbers are relatively low should, under no circumstances, mean that we must be complacent. We need to act with vigilance and be so serious in following all regulations that have been put in place. The province, in terms of the status quo, the province continues to rank as the second highest in terms of the number of laboratory confirmed cases countrywide, contributing 19%. And therefore, the total number of cases since the beginning of this pandemic stands at 346,329. We rank as the 4th highest in terms of fatality countrywide, following Eastern Cape, Gauteng, and Western Cape. Within the last 24 hours, in terms of our reporting period, the province has reported 589 new COVID-19 infections and 1 new fatality, and that brings to a total of 10,615 when it comes to a number of people who have passed away due to COVID-19 in the province since the pandemic started. In the past 2 weeks, the overall percentage change in the number of new cases between week 24 and week 25, and that was a change of about 40%. The actual number of cases was 1,772 for week 24 and 2,943 for week 25 respectively. And I want to highlight this. So you will say 2 weeks ago, we had new infections of 1,772. Last week, meaning as of Saturday, counting from Sunday till yesterday, the new cases were 2,943. And you see that we've gone more than, we are close to doubling the numbers. I'm emphasizing this point because we might take that because we are not yet at the third wave, think that the rate of infections is not high. It is growing and growing seriously. 10 districts had an increase of more than a third of the cases received a week, with the exception of Herikwala. The increase in the number of cases is also evident in the incident risk and the average cases, which is the 7-day moving average. The incident risk increase from 16 to 26 cases per 100,000 population in the past 2 weeks. So the increase you will see from 16 to 26. 5 districts, which are eThekwini, uMgungundlovu, uThukela, Amajuba, and Umzinyathi, continuously receive the highest number of cases on a daily basis. Only Herikwala district observed a remarkable decline in number of new cases in the past week at 64%. Again, all of this should serve as a proof of how real the threat of resurgence really is. The number of hospital isolations continues to fluctuate, with a slight increase in daily admission in both private and public hospitals, including ICU and patients requiring ventilations. We want to reflect on the threat of school holidays and inter-provincial travel. The current increase in cases is driven to a large extent by school and family clusters. We are concerned with the upcoming winter school break due to the fact that our second wave happened during holiday seasons, as many people would travel to KwaZulu-Natal for holidays. We welcome all the visitors who will be enjoying themselves at our beaches and other areas. However, we urge everyone to understand that we will not compromise on compliance with COVID-19 protocols. Everyone should actually become much more vigilant than ever before so that we curb the spread of this virus. We reiterate that no event should violate the level 3 lockdown regulations. Those who violate regulations will face the full might of the law. The province is nevertheless prepared for any resurgence of cases in terms of bed availability and oxygen capacity. We are urging citizens to go to the nearest health facilities if they have been in contact with a confirmed case, or if they have flu-like symptoms, or if they feel generally unwell. It is important to report to the health facility as early as possible. In terms of the distribution of cases by reporting and district, of the 589 new cases recorded on the 19th of June, eThekwini district recorded 37% of that and was followed by uThukela at 14%, uMgungundlovu at 12%, Amajuba at 6%. The average number of cases received in the past 7 days was 459 cases per day, while the average number of cases was 338 cases per day. Now, we have then provided the distribution of cases and deaths, and let me focus on new cases in terms of percentage. eThekwini, 37.4%. Maybe numbers will bring this picture more vividly. eThekwini, 220 new cases were reported, 31 in Ilembe, 72 in Mgungundlovu, 81 in uThukela, 29 in Kingcetshwayo, 15 in Ugu, 67 in Amajuba district, 3 in Umkhanyakude, 6 in Herigwala, 22 in Zululand, 35 in Umzinyathi, and 8 unallocated. And that gives the total of 589. In terms of hospital admission and isolation, as of the 19th of June 2021, the province had 677 patients admitted in both private and public hospitals, with 554 in private hospitals, which is 82%, and 123 in public hospitals, which is 18%. Of those admitted, 110 or 17% of patients required intensive care services. Private hospitals had more patients in ICU at 96%, or in numbers 106. Then public facilities had 4 patients in ICU, amounting to 4%. We will also wish to take this opportunity to provide the update on vaccination progress. We continue to make significant headway with the vaccination of both our senior citizens, age 60 and above, as well as healthcare workers who could not be vaccinated during the first phase. As of the 18th June, we had vaccinated 362,226 senior citizens, as well as 127 health workers. The total number of senior citizens who are currently registered on the electronic vaccination data system currently stands at 501,210. The number of vaccination sites that we have now prepared for the Pfizer vaccine is 359, whereas for teachers who will be receiving the Johnson & Johnson vaccine, from the 23rd of June to the 8th of July, we had prepared 91 vaccination sites. The province is now vaccinating 13,000 people per day. We are intensifying vaccination of the elderly and increasing more capacity, especially in township and rural areas. As we conclude, we wish to make a call to action. It is up to all of us to prevent infections. Each and every one of us, in our little corners, wherever we are, we should be making sure that we make contribution toward ensuring that the numbers that we are seeing do not amount to a storm. The past 2 waves of COVID-19 have shown us how brutal and vicious COVID-19 can be. Siyafisa ukugcizelela ukuthi masilalele singenzi engathi senzela uhulumeni. Bambalwa kakhulu abantu abangathi abakazi balahlekelwe amalunga omndeni noma izihlobo noma ababaziyo nje ngenxa yalolu bhubhane phambilini. So i-wave yokuqala neyesibili ibe namandla amakhulu, especially i-wave yesibili yasishaya kakhulu KwaZulu-Natal ngaphe kwawo wonke mhlawumbe amanye ama-province. Kungangebe ngaphe kwawo wonke ama-province ngey'namba zabantu abadlulile emhlabeni, kodwa izwele kakhulu KwaZulu-Natal. Siyafisa ukuthi wonke umuntu azi ukuthi uneqhaza ekudinga libambe ukugwema ukuthi COVID-19 inyuke ngamandla, ngoba lokho kuzosibuyisela emumva kakhulu. It is therefore up to us to ensure that we support our senior citizens by getting them registered for vaccination and to also help them get vaccinated. Each and every one of us has a duty to ensure that we avoid large gatherings. We wear our mask at all times, wash our hands with water and soap or hand sanitizer regularly, and maintain social distancing. We appeal to young people to protect the elderly and those with comorbidities by avoiding parties and large crowds, as well as wearing masks even at home. It remains crucial for us to adhere to the non-pharmaceutical intervention, such as wearing of masks and maintaining social distancing and washing our hands regularly with water and soap. I want to underline the point. Young people, as we say, even at home, they must wear masks. It does happen that they will go out and then they go back home visiting their parents, and they think that they will not transmit infections. You might go home feeling no symptoms, but find that you will then transmit infection to your parents or your loved ones. Once again, we call on all of us to be responsible, and let's protect the elderly and those with comorbidities. Even where we go there, we know it's home and we are used to them. Let's avoid large gatherings. I thank you. I thank you all, and thanks for being with us again. We will engage with questions as usual. Thank you, Mr. Mobas.
Thank you. Good afternoon, Premier. Good afternoon, MEC. From Newsroom. In terms of your tracking of the virus, virus and the fact that it might move to a third wave, is there a possibility that there might be underreportage of new cases and that's why we're not at the third wave yet? I'm not saying we are, I'm just asking for clarity. Is there a possibility of underreporting bioscientists or data? How much of that do you leave room for? And then MEC, also were with you in Kutu the other day and you talked about how hard it is for connectivity in rural areas. And I mean, Kutu had only 16%, I think 18 also, of people that were already vaccinated. In KwaZulu-Natal as a whole, right, also looking into that as you go to rural areas, how hard it is for them to get vaccination going, particularly now that we're going to a third wave and that connectivity might be an issue. And then finally for me is, we heard the Minister of Education talking about schools, and now that we're going to a holiday season, how much that will be a problem regarding that people will also be visiting from other provinces. Surely that has you worried regarding infections and also schools closing, that might take us the number of infections daily quite high. Thank you.
Thank you very much. It's also good to info to certain questions that raised. What has been a secret to KZN's low numbers? You know that people are still very poor at following protocols, which is why the president moved us to level 3. How has KZN kept the numbers low? And what can other provinces learn from the approaches KZN in dealing with the pandemic?
No, thanks. I will take one from Bonga, which is about the school holiday. As I've indicated in the statement, the second wave came with the school's holiday season. You will remember of the student activity in Palito and other areas, other activities. So we're quite concerned about that. And that's why we are saying, while we will welcome people who are coming from other provinces, we will be strict in ensuring compliance. And we want to ensure that all people who come to KwaZulu-Natal for their holidays, they enjoy themselves responsibly. They should adhere to the COVID-19 protocols. It is not only for us, it is for us and themselves. And therefore, we will also not want to take ourselves out of South Africa. We are part of the national, we are part of the country, South Africa as a whole. All South Africans are free to come to KwaZulu-Natal for holidays. And it should not, the impression that this is high there and there, should not give us any comfort as if we're better off. And as commenting on the last question, we're not better off. And the wave hit you without even any forecast. We may say, going forward, we think we will do this and we will not get into the third wave. We will do everything we can, but with the support of the people, then we can survive. Without the support of the community, we're not going to stop the infection. And that's why I see kumuntu ngomuntu manje. Umuntu nomuntu kudinga thathe adlale naye indima yakhe ngoba kubalekile lokho. Akona nje kuphela ukuthi inkinga abantu abasuka ngaphandle kodwa ukuthi imiyalelo yokuzivikela siyilandela kangakanani. And therefore abantu abazosuka kumaphi ama-provinces beza KwaZulu-Natal kuzodinga ukuthi nabo bawa-enjoy ama-holiday kodwa bewa-enjoya baphile ngokuthi balandela yonke lemigomo ebekiwe ye-COVID-19. Dingekile ukuthi sisanitize, siwash izandla, sifake ama-mask nanoma yinini, siqinisekise futhi ukuthi asiyi ey'ndaweni eyi-overcrowded. Ngiyabonga.
Thank you very much, Mr. Mabaso. Good afternoon, ladies and gentlemen. Good afternoon to the Premier, and thank you very much for that statement, Premier. Mr. Mabaso, let me start with the question raised by Ubonga and asking, I think he was asking both myself and the Premier on whether is there a possibility of underreporting. I think scientifically, Bonga, there is always a challenge in any system. There are always possibilities, especially when you run a system as big as the Department of Health, particularly as big as the Department of Health in KwaZulu-Natal with 11 districts and different people that are doing different work and reporting separately. So at no point do we say it is not possible, and at no point do we say it's not being done. However, we have put some systems in place to ensure that where there is under reporting, we are able to pick it up in the next day or two and be able to report on it. That is why when we report, for instance, on those that have passed away, when we report on, when we give or provide the daily statistics, we make it clearly known that those are not necessarily people who have passed on that particular day, but it is people that have been reported on that particular day. The reason why we clarify it like that is because every 7 days or so, our system and those who are managing our M&E have to go back and ensure that they look at all the loopholes and everything else that could have fallen by the cracks and make sure that they cover them up. Right now, we are working on a program of ensuring that we look at whether, for instance, we have reported all those that passed away between the first and the second wave. Looking in particular on the deaths that happened at home. We will be providing a proper report in the next couple of weeks, and we will then indicate whether we reported everyone, and if there are those that were underreported, we'll then provide that particular report and update. The reason, and I'm quite glad you actually asked me this question because you're giving me an opportunity to explain what we are currently working on. So we will then be able to report on where we are, what are our numbers, the actual numbers, whether the numbers that we have currently are a true reflection, or whether there has been a few that have not been reported correctly over the past few months, and we will then be reporting them. The reason why we believe that it's correct for us to run that process is because, like I said, there are a lot of people who are running processes that are reporting, and the reporting lines are not always to one institution. Some report directly to the district directors, some will report to the province, some report directly to national. But as a province, we've then decided to look at both our infection rates and see and tally. In essence, that's what it's going to be, and tally the numbers that we have and the numbers that are actually on the ground, and we will be doing the same thing with the number of deaths. So I'm saying to you, when you have a lot of people that are reporting, it is always a possibility, but we have put systems in place to make sure that where there is underreporting, we are able to come back and own up and say there are areas where we underreported, and we will be correcting those as we move along. That is a program that we will be running throughout, and we have been conducting from when we started with, when we first received our first COVID case, and those that have first passed away from the virus. In relation to the connectivity in our rural areas, you are correct. When we went to Engutu on Thursday, it's one of the areas where we picked up that connectivity is a problem. It's not just a problem in Engutu. There are a few other rural areas in the province that are facing that particular challenge. And it's purely on those bases that we decided to engage, among other things, on the program that we engaged on Thursday. And a week before we went to Engutu, we had met with some service providers that are working for government, are working with government in terms of connectivity, to try and find a way of ensuring that our facilities that are not connected are able to get connectivity on time, and are able to are given a boost, in particular in areas where we find that connectivity is a challenge. It's not all our hospitals in particular that have a challenge with connectivity, but we find that a particular percentage of our clinics, because of their location and where they are, they struggle a little bit with connectivity. Hence, we are engaging in this particular program. So yes, we have found it to be a bit of a challenge, but we are finding ways around dealing with that. But we've also, after engaging with National in the issue of connectivity, we've also been allowed to actually capture manually, so that where we are unable to connect directly on the spot, we capture manually, and then later on we are able to upload. So yes, we have that challenge, we are working on it, but we've also found a way to work around it. Is the issue of the schools that are closing going to be a challenge? We are worried, as the statement of the Premier was indicating that. We are purely worried because of what we saw during the second wave. Second wave showed us that one of our factors that, or contributing factors to our high numbers during the second wave, was the fact that schools were on holiday. There was a lot of visiting. There was a lot of people who were on holiday, a lot of people who were having parties, a lot of young people who were having parties in particular. And I think after the Palito incident, we never went back as the province in terms of the second wave. That is where our high numbers started climbing, and they climbed right up until 6,900 a day, which is our highest number of infections that we received during the second wave. So we are a bit worried about that. Hence, we are having this briefing to also say to our communities, the issue of infections is not just about government doing something, but it's about all of us working together and ensuring that when we go on holidays, when we have fun, and when we want to relax, let's make sure that we do so in a safe manner. Let's make sure that we do so in a manner that protects ourselves, but that also protects everyone. I must also indicate, however, Bonga, that the issue of schools and our concern with the schools is not just in relation to the fact that schools are going to be closing and our learners are going to be going home and we are not sure what they are going to be doing. We have found in the past week or two that even in the schools themselves, we have found clusters of infections within the schools. So, you know, the issue of parents taking ownership is also quite important. That's why last week we made a call that when a parent realizes that their child has flu-like symptoms, can they please ensure that the child or the learner does not go to school, so that they don't start spreading the infection amongst other learners. Because once you spread amongst learners, then you know the virus will go very, very far. For instance, in Mutu, you were there, Bonga, when we were told that one of the schools, a learner, once the district found 16 learners that were infected, and as a result of the 16, which we believe was quite high, we decided as the Department of Health to go back to the school and test all the learners. And out of all the learners, we found 56 learners that were infected. So it is quite a worry. We have seen other clusters in other districts as well of schools that are being infected. So we are discussing with the Department of Education on how we manage the infections in school, because that becomes their turf, and how we operate and how we work is important. That there should be a partnership between the Department of Health, the Department of Education, but most importantly, the parents, because they also have a responsibility to play, or a role to play in this particular instance. In relation to the question from News 24, what is the secret to KZN's low numbers? I think, Premier, when we have these briefings, we are not trying to say or show off our low numbers, but what we are trying to say to the community is that is to indicate that the virus is still there. Now, whether we have a secret weapon on the low numbers, I would not want to comment on that, but I want to indicate that we, like all provinces in South Africa, I think, are maintaining strict protocols when it comes to the tracing of those that have been infected and following up on those that they have been in contact with. We have tried to make our communities aware on how important it is to isolate. We know that in terms of science, it actually should be isolation at a facility more than self-isolation at home, but we are aware that other people have the capacity to self-isolate. So we do encourage our communities to come to our facilities for isolation when they find themselves as being infected. But of course, it is not compulsory anymore that you isolated our hospitals, and those that have capacity to self-isolate are allowed to do so. So what I'm trying to say here is that the numbers that we are seeing should not be something that we should be excited about, because we still have the virus anyway as a province, like any other province. During the December and January holidays, we, as Premier correctly indicates, we were, as a province, we were the hardest hit by COVID-19. But at that point, we had also done just as much work as the other provinces. So this virus is very unpredictable in how it operates. And at no point do you celebrate just because you think your numbers are lower than another province at any particular time. We might wake up in a day or two, find ourselves having tripled the numbers of infections that we have today because of the behavior and conduct of the community. In fact, even as we speak today, we have, Premier was just giving us that in the last 7 days, we have accumulated more than 2,500 infections, which means we have tripled the numbers that we had in the last 7 days. So really, in as much as they are low, but they're nothing to celebrate about, they're nothing that we should be excited about, because we can clearly see a pattern of us increasing the numbers and or increasing the infections, and that is a serious worry. Thanks, Mama.
Thank you very much, Mamas. Besicela ku-MEC asiphindelele lapha athethi abazali bagcine iy'ngane emakhaya ngesizulu bese ngiba nombuzo wami wena MEC useva. We see the numbers when it comes to healthcare workers, it's 127. Is that number too low? Or what is the problem that makes the healthcare workers not come forward to vaccinate? And you also see that the 91 sites for the teachers. How soon, what is the plan in relation to vaccinate the teachers in the province? Thank you.
Thank you, MEC. While you're still there on the question about teachers, what about those ones who don't want to vaccinate but are still teaching at schools? What happens then? Is that a problem for the department in terms of that? Are you negotiating or engaging with unions because they have to go teach class again? I'm just trying to understand the logistics there.
Okay, I think Ubonga had a comment.
Yeah, if it's the last round, I think I should ask. This has nothing to do with this briefing. Premier, I'm not sure you expected that we would ask, but we just came back from Konongo yesterday, and there seems, Premier, to be a battle brewing there regarding the kingdom of KwaZulu, because when you speak to one side, Mrs. Zulu is the recognized king, but when you speak to the family also, at Waketo Tanda, they're saying that now that they've done the cleansing ceremony, they'll discuss succession, implying that they don't recognize, they won't say that they don't recognize him, but that's what they imply, that is not the rightful king because they didn't do it the right way. Where does that put you as the premier in the province, seeing that the province oversees what happens in the kingdom?
All right. Let me then firstly start with a response Kamlondi. Siyacela ukuthi abazali ikakhulukazi uma ngabe bebona ukuthi ingane iqala ukuba nama symptoms angathi awe flu abangawazi nabangawaqondi, ingane ingayi esikolweni ngenxa yokuthi uma ngabe ingathestiwe ihambi esikolweni ifike esikolweni ithelele ezinye ingane, and ekutheleleni ingane nazo sifike zithelele abazali emakhaya ebese labo bantu abathelelekayo bagcine sanda isibalo ngendlela enkulu kakhulu. Siyazi ukuthi othisha njengoba besesikolweni abatrainwanga bona ukubona ukuthi ingane ngokwezempilo iyagula noma ayiguli, ingakho ekutheni sibambe ukuthelelana kwaleli gciwane ezikolweni kakhulukazi kubalekile ukuthi umnyango wezempilo, umnyango wezemfundo nabazali sibambisane ukuze sikwazi ukuthi siligcine. Kuyenzeka ke ngesinye isikhathi ukuthi ingane ihlale nomuntu ekhaya okade ethelelwe yileli gciwane mhlambe wase isolator ekhaya, base abazali bengabe kusabonakala kahle ukuthi ingane ngempela ayinalo yini igciwane bisiyahamba esikolweni ifika ithelele ezinye ingane, noma mhlambe bivakashe endaweni ekade kunomuntu otheleleke khona bese ingane iyaqhubeka esikolweni ithelela abanye. Siyacela siyanxusa kakhulu emphakathini ukuthi abazali kakhulukazi abangenelele ababambisane nohulumeni ukuze sikwazi ukuthi silivimbe leli gciwane ngoba iyona ndlela esizokwazi ukuthi silivimbe ngayo. Sikubonile ke lokho emavikini amabili amathathu edlule ukuthi kunezikolo lapho kuqala kubonakala khona ukuthi ingane ziyathelelana esikolweni, noma ethelelana ingane kusho ukuthi igciwane ziyalithatha zilibuyisele emakhaya. So kubalekile kakhulu ukuthi sibambisane. But njengoba ke sekuzovalwa nezikolo, siyacela ukuthi abazali bayigade futhi ingane zingabi uvanzi, zingagcwali emgwaqweni, zingayi emaphathini kakhulukazi lezi eseyikhulakhulile, zingayi endaweni zobumnandi ngoba uma ngabe ingane zitheleleka ileli gciwane azivamile ukugula kakhulu, ezinye zigcina zingenawo ngisho ama symptoms lokho kubizwa ngokuthi baba asymptomatic. Uma ngabe ke ingane isibuya inalo igciwane kodwa ingenawo ama symptoms, akulula ukubona ukuthi sithelelekile, igcina ifika ithelela abantu abadala emakhaya, abanye sebengaphezulu kuka 60 bese bayagula kakhulu, abanye abanama comorbidities lawo esiwabiza ngokuthi amahlala khona bese ke bayagula ngempela. Kuyenzeka ke ngesinye isikhathi ukuthi abantu abadala nabanama comorbidities uma betheleleka bagcine begule, abanye beze bedlule emhlabeni ngenxa yalokho. So kubalekile ukuthi sibambisane nomphakathi, sibambisane nabazali ukuthi kulesikhathi samanje izingane sikwazi ukuthi siyigade ngendlela eziyiphatha ngayo nendawo ezihambayo ukuze igciwane lingatholakali selanda izwe lonke libhebhetheka. Ngicabanga ukuthi there was a question as well that was saying 127 health workers, is it too low? Ngicabanga ukuthi there's a mistake there, Lord. It's supposed to be 127,501. So it was just a typo. But in terms of whether that amount is low, we don't believe it is low. Right now, we are at about 80% of our health workers that we have vaccinated. One of the challenges that we have is the fact that vaccination is by choice. Vaccination is not compulsory. So any health worker, like any person who lives in South Africa, they have the constitutional right, they are protected under the constitution to be able to say, do they want to be vaccinated or not? So we have found that there are a few that are still not, are a bit reluctant to be vaccinated. There are those that are saying vaccinating is against their religious beliefs and we can't force them. But we are discussing and having negotiations with some of them, particularly those that are worried purely from an element of being worried about their health. Those we can talk and we can have a discussion and try and guide each other on what would be the way forward. So we have found that at this point we've not been able to vaccinate all our health workers purely because of that. But We do have the vaccines available. You know what is quite nice is that even those health workers or some of the health workers that were not willing to be vaccinated during the first trial, during the Sisonke trial, some of them now are beginning to come back and say they have now seen how this particular vaccine is working. They are willing to be vaccinated. So it's a step-by-step situation that we are taking each other on. But we didn't want to stop the whole vaccination just because we only have now about 20% of our health workers that have not been vaccinated. I think on the same breath, are teachers going to be forced to be vaccinated? No. Just like health workers, it also has to be something that they agree to. It also has to be something that they concede to doing. How the Department of Education is going to manage the issue of teachers that are not vaccinated, I think it's something that we will leave with the Department of Education, but I would believe that they would manage it the same way we are managing, by persuading each other and, just looking at what are the issues and see if we can attend to the fears that are there. Because the reality is that the vaccine is something that is new to all of us, and people will have fears because of a number of narratives that are out there. The important thing is that, are we able to talk each other through that and get everyone to be on board and buy into this? The Department of Education is also engaging with their stakeholders, which includes the unions. That is why when we were ready on the 9th of June, we did not proceed with vaccination of teachers because the department needed to put its own plan in place, and its own plan included engaging all the stakeholders. I mean, we had done that a long time ago as the Department of Health because we were the first ones to be hit, but we needed to provide the education that space to be able, to provide the Department of Education the space to be able to engage their stakeholders. So they have been working on that, and that is why now we will be able to continue with the vaccination, and there's a date that has been provided. We will be having a media briefing, myself and MEC Mshengu, when we start the vaccination of the teachers, and there we'll be able to provide a proper plan on how the teachers are going to be vaccinated. However, from our side as the Department of the Department of Health, we have decided that in other areas there might not be vaccination sites. Therefore, we needed to establish new sites for educators, and that is why in the media brief, so that is why in our statement you find that there is a number that we have indicated that it's a number that will be utilized to vaccinate educators. But there are other areas where we are not establishing new sites, and areas that are central, and where we'll be able to run two parallel processes between your 60 years and above and the educators. So it's not all areas, or it's not all communities where educators are going to be vaccinated with the elderly. In other areas, we are establishing new sites. In other areas, we'll utilize the sites that we have. I think that those are all the questions, Mr. Mabas.
No, thanks. I think we would like to add to an emphasis. The 127 is for the phase 2.
Yes.
It does not include phase 1 that was done, as MEC was saying. And I think the issue raised by Sihle, the team led or sent by the minister will be going there. And if it is discovered that this is diamond, they would then work with the local community to ensure that that diamond is further tested, and then it is further processed toward ensuring proper licensing and mining. That's all. Using the very same mining charter, which I believe has a space for local community to benefit. And I think that is the only thing I can see. Bonga, ukubuya kwakho kaNongomizo. Ngaphandle lothi ubungasixoxelanga ukuthi wena uya kaNongo manje usubuya nezindaba zakhona. No, as government, we will be meeting with the Royal House because we wanted the royal family to go through the cleansing ceremony and respect them, respect the nation, the late king and all, as well as the Queen Regent. And within that understanding, we've taken a deliberate view that it is better to discuss issues of this nature internal, meaning let these issues be discussed, not publicly, but allow those who are eligible to discuss such issues to discuss those issues on their own, internally and with respect. The fact that each and every day we will be having public engagement about this matter of the Royal House and all of that might end up undermining the respect and the dignity we've always accorded and preserved for the Royal House. So please, when there is a time to speak, we will speak, but we've decided that the matter should be handled by relevant stakeholders with the respect also, with the respect of the royal family. It should be known that even in ordinary families, not everything is discussed by anyone and everyone, and not everything is discussed in public. So let's allow the Royal House the space to discuss, but let us also give them the respect and plead that they continue to discuss the issue and all other issues within the royal family and among themselves, and come to engage the public when they have finalized those issues. Thank you. Siyabonga. Sifisa ukubuye siqale ngokubonga ukuthi abezindaba bayaqhubeka nokusilekelela ekutheni sidlulise imiyalezo efundisayo nekwazi ukunikezela i-update kubantu bakithi ngokuthi isimo esikuso se-COVID-19 sithini. Siyafisa ukuqala nje sifisele bonke obaba usuku oluhle nolunesbusiso. Kunobaba abaningi abahlonipha isizwe, abasebenza kanzima for imindeni yabo, bavikela abantwana nomama. Siyaqinisa ukuthi obaba babamsane ekwakhiweni kwesizwe ngokukhulisa kahle abafana, nokuthi sinqande ukuthi kube khona abantu besilisa abaziwa ngokuhlukumeza. Angenziwa lokho egameni lethu. Sibonile insukwini ezidlule abantu betheleka ngobuningi lapha endaweni yakwaHlathi engaphansi kwamasipala obizwa nge-Alfred Duma, iLady Smith, ngenxa yokuthi bazwe obabone ngathi kunegolide. Into esiphatheka kakhulu ukuthi ukuhlangana kwabo kungalidela ekutheni kuspread kakhulu i-COVID-19. Siyafisa ukuthi sigweme ukuhlangana eindaweni la sibabaningi khona okungasilidela ekutheni sitholane nezifo isikakhulukazi lolubhubhane esibhekene nalo. Asisho nje kuphela kulabe bebelapha, kodwa kubo bonke abantu bakwaZulu-Natal le-South Africa yonke. Namuhla ithimba eliholwa ngu-MEC wa-Economic Development, Tourism, Environmental Affairs, umphathiswa uPhile, ngokunjalo okukhona kulo u-MEC wezokuthutha, xhumana nenhlalakahle yomphakathi umama uNkonyeni naba ama-officials e-Department yaka Mineral Resources and Energy bahambela leya ndawo bazoxoxisana noma-stakeholders mese bethula umbiko ngokuphelele ngo-4 namuhla ntambama yanamuhla ukuthi kahlehle idayimani leliya noma yini. Siyafisa ukuthi kwehle umoya silindele leyo mbiko ngoba iwona loyo mbiko ozokwazi ukusisa phambili. Siyazi ukuthi iSouth Africa isibuyele ku alert level isigaba sesithathu ngokwemiyalelo nemigomo ye-COVID-19. Sibonile siyabona kuqhubeka ukuthi izinga lokutheleleka kwabantu liye kukuya linyuka. KwaZulu-Natal enyangeni ezidlule besivama ukuthola abantu abathelelekile babe 130 kwezinye inkathi baze babe 70. Kodwa namuhla leso sibalo sesinyuke kakhulu ngoba sesithola abantu ababa ngaphezulu ka500 ngosuku. Kube khona ke usuku la kuba khona no 400. Nakuba singakangeni kwi-third wave kodwa siyafisa ukugcizelela kubo bonke abantu bakithi ukuthi asigweme ukutheleleka. Siyogwema lokhu ngokuthi silandele imiyalelo ebekiwe, sifake ifonyo, siwashe izandla, sisebenze ngamanzi nensipho, sisebenzise isanitizer, sigweme ukuya ey'ndaweni ey'nabantu abaningi. iKwaZulu-Natal ingeyesibili ngey'namba zabantu abatestwe positive for COVID-19 kanti ingeyesine ebantwini esebedlulile emhlabeni ngenxa ye-COVID-19 silandela i-Eastern Cape, Gauteng kanye ne-Western Cape. Emahoreni angamashumi adlule kubikwe ngosuku ama-cases angu-589 okuvezayo ukuthi izinga lama-case linyuka kakhulu. Indawo ey'thintekayo ama-district especially amahlanu okuyiTheku, uMgungundlovu, Thukela, amaJuba noMzinyathi. Kanti KwaZulu-Natal iHerigwala kuphela la ebonakala khona kunezibalo ezihlayo. Siyafisa ukugcizelela sonke masigweme ukuthi sitheleleke noma sidlulise lesifo to abanye abantu. Noma kunjalo sigcizelela ukuthi njengohulumeni silungisile ukuthi ibhedlela ikwazi ukunikezela usizo oluphuthumayo noludingekayo kubantu. Siyayazi futhi ingozi esibhekene nayo yamaholidi njengoba kuzovalwa nezikole. iKwaZulu-Natal indawo la abantu abathandayo uvashela khona. Ngeke sabavimba kodwa siyafisa ukunikezela umyalelo oqinile othi wonke umuntu oza ngapha nomuntu nje ozobe KwaZulu-Natal even ngekhathi zamaholidi akayilandele imigomo ebekiwe, ayilandele ngoba kunjalo. Sizosiqinisa isandla. Asifuni futhi ukuthi kuze kufinyelele esimeni la uma sibona ukuthi izinamba ziyanyuka sifuna ukungenelela kwabangaphezulu kwamaphoyisa. Asingafinyeleli lapho. Asibamsaneni kusezandleni zethu. Ama-cases abonakala ey'ndaweni enyuka kulo 589 u-37% uvele eThekwini, u-14% uvele oThukela, u-12% eMgungundlovu kanti u-6% emaJuba. Ilama district abukeka enyukelwa izibalo kakhulu kungashiwo ukuthi amanye ayinyuki. Onke ama-district ngaphandle kweHerigwala sibhekene nenkinga yokuthi lolu bhubhane luyibonakala lunyuka. Siyabonga ukuthi abantu abaningi abadala baphendule ngendlela esicelweni sokuthi bathathe umgomo. Njengamanje abantu esebegonyiwe bangu 362,226 abantu abadala bebodwa, kanti kule phase yesibili abasebenzi bezempilo abagonyiwe sebengu 127 okeda kuleya phase yokuqala. Siyabonga futhi baningi kakhulu abantu abadala abangapheka 60 years ababhalisile, ngoba njengamanje abantu asebebhalisile abakwi-queue yokuyogoma esingathi bazolokhe bethintwa ukuthi iy'nsuku zabo ifika nini zokugoma KwaZulu-Natal bangu 501,210. Siyazi futhi sisemkhankasweni wokuthi sigome nothisha. Lokhu kuzoqala ngomhla ka-23 kaJune kuze kuyoba ngomhla ka-8 kaJulayi. Siyafisa ukugcizelela njengekwaZulu-Natal sikwazi manje ukugoma abantu abangu 13,000 ngosuku, futhi siyaphambili nalomkhankaso ukuthi abantu mabagome. Masingakusabi lokho, masiqhubeke futhi sizama ukuqinisekisa ukuthi silekelela abadala especially endaweni zasemakhaya ukuthi bakwazi ukubhalisa. Siyafisa ukugcizelela masiphethe ukuthi kusezandleni zethu umuntu ngumuntu ukuthi sigweme ukutheleleka nokubhebhetheka kwalesifo. Bambalwa abantu lapha KwaZulu-Natal abangathi abazimuntu kwagula kumbe wadlula emhlabeni ngalesi sifo. Ngakho ke sonke masiqinisekise ukuthi siyazivikela, sivikele nabadala. Sifake izifonyo, siqinisekise ukuwasha izandla ngamanzi nensipho, sisebenzise isanitizer uma kungekho amanzi nensipho eduze. Senze isiqiniseko sokuthi sishiyelana isikhala, social distancing, uma sisey'ndaweni zomphakathi. Siqinisekise futhi ukuthi siyayigwema indawo enabantu abaningi. Silandele yonke imigomo. Lesi sifo asizisukeli siye kumuntu, kodwa sithathwa ngumuntu asidlulisele komunye. Uma ke sibambisene siyokwazi ukwehlisa amathuba nezinga lokwenyuka kwalesi sifo. Siyabonga.
Would like to get a comment in relation to the recent judgment by the Premier of High Court on Ingonyama Trust land. We'd like to get a comment
On both or?
on both.
Okay. Okokuqala udaba lwaseNdlunkulu njengohulumeni waseKwaZulu-Natal sinakho ukuxhumana neNdlunkulu yonke. Okwesibili siyafisa ukucacisa ukuthi nesinqumo esasithatha sesikholwa ukuthi sibaluleke kakhulu. Lesi sinqumo sithi asiqinisekise ukuthi zonke izinto ezithinta iNdlunkulu zisingathwa ngenhlonipho nangesithunzi esifanele. Akuzona zonke izinto okuzomela sizikhulume ngaphandle kwendlunkulu o sizikhulume emaphephandabeni nasemsakazweni. Izindaba ezithinta indlunkulu especially lezo kubonakala zixoxwa kungakuhle kakhulu ukuthi zixoxwe ngaphakathi yilabo abafanele. So uma sebexoxe ngaphakathi ngesikhathi esifanele basibikele lokho abasibikela khona. Njengamanje ke uhulumeni uzokuhlangana nendlunkulu, kodwa ngiyafisa ukunika isiqinisekiso ukuthi kuyoba umhlangano nje nabasendlunkulu, kodwa hayi ukuthi umhlangano yobe umayelana neindaba lezi. Umhlangano nje ukuthi sisebenzisana kanjani ukuya phambili. and njengoba besilokho esenza kukhona ubayede. Udaba ne judgment le ye Royal Trust Ngonyama Trust, I'm sorry. Indaba ye Ngonyama Trust si utholile umbiko sizwile sisayifunda ijudgment yonke sizokwazi nathi ngokubambisana nohulumeni umnyango ofanele uhulumeni kazwelonke umnyango ofanele umnyango oholwa ngumama uThoko Didiza siyokwazi ukuxoxisana ukuthi lo daba sethi singatha kanjani. So sise kwi level la sithi sifuna ukufunda kahle sibuyekeze ngokuphelele ijudgment. We are still considering the judgment. We're studying the judgment on Ngonyama Trust. We will make our input and contribute to the process because the whole process is led by the Minister Thoko Didiza. So we will want to make our contribution after having considered and studied the judgment sufficiently and got good interpretation, and then we will be able to speak from there. Thank you.
Thank you.